Some more faculty members have joined. Welcome Abhishek, welcome Vikram.
Good evening, sir.
Good evening.
Hello, everyone.
Hello, Dr. Abhishek.
Hi, it's 11:30. My name is Karthik Iyengar. I join you all from Warrington. So where's Warrington? Warrington in England. If you drop a pin in England, it will fall in Warrington. So welcome to one and all. First, let me invite Professor Vaishya and Professor Gopinathan to open the program for us. Professor Vaishya, I will start your video in a minute.
Recording in progress.
Good evening. I am Dr. Raju, Editor-in-Chief of Journal of Orthopedics and Journal of Orthopedic Report. I welcome you all for this course, which is happening for the second time. This second JOO course aims to foster interest in research and publication, especially in young people, to resolve the doubts of the participants. We have tremendous response for this course with more than 1,000 registration. We have eminent faculty of the Journal of Orthopedic editorial board who will be presenting various lectures. It is a virtual meeting. And we are happy to inform you that we have partnered with Ortho TV, which will also be telecasting this program live. The course conveners for this today are Professor K.P. Iyengar from UK and Professor Vijay Jain from RML Hospital, New Delhi. We have distinguished faculty of the Journal of Orthopedics who will be covering various topics for this course, and I thank all of them, and they are listed here. Various topics have been covered, starting from very basic to advanced aspects of research and publication. All the presentations are pre-recorded and are around 8 minutes each. At the end of presentation, we'll have question and answer session. So all of you who want to ask any question, put it in the dialog box of Zoom. We'll also have discussion on a pre-selected paper which has been circulated already to you all. At the end, we would request you to provide us the feedback form which has been given. And on the receiving of feedback form, we'll be issuing the certificate of participation. So this is important that you fill up the feedback form. Journal of Orthopedics have been growing significantly over last 1 decade. We are now #1 orthopedic journal in India and #4 amongst all Asian countries. Our citations and submissions are increasing significantly, and last year alone we had 2,578 citations. Our H-index has moved from 23 to 30 in last 1 year. Site score has also been moving up and currently stands at 2.5. We have maximum authorship from USA and UK, followed by India. So it's a true international journal. We have more than 1,600 publications listed in PubMed and Scopus. We started a companion Journal of Orthopedics last year, that is Journal of Orthopedic Reports, And we are happy to share that last year we received more than 300 submissions and published 103 articles from it. We have 23 editors from 7 countries. We are already indexed in its first year with the Directory of Open Access Journal, which is recognized by National Medical Council. It is I am very thankful to our publisher Elsevier for giving us waiver for article processing charges for 2022 and now also for 2023, although being an open access journal. And now we publish all types of article, and it's a quarterly journal which we publish every 3 months. The future vision of Journal of Orthopedics include monthly publications, which we have already started from January 2023. So now we'll be publishing 12 issues per year as compared to 6 issues before. We are in the process of applying for Medline indexing, and I'm happy to share that we'll be receiving our first impact factor in June 2023. The Journal of Orthopedic Reports is also doing quite well, although in its infancy, we are applying for PubMed Central indexing this year and Scopus indexing for next year. We'll be issuing such certificate of participation to all the delegates on completion of feedback form. I would request all of you to become an official reviewer of this journal, which you can do it by going on the journal website, and the link has been shared here. And on the completion of review, you will be getting a certificate of reviewing, and also those who have completed at least one review are entitled to access all the articles of Scopus for 1 month for each review. So I thank you once again for joining this course, and I hope you take away a lot of understanding from this course, which will help you to foster in research and publication field. Thank you. Now I invite our managing editor, Professor Gopinathan, to speak a few words about this journal and the course.
Happy to meet all of you in one forum, and Professor Raju Vaishya has told almost everything. There's nothing more to add, and we aspire to be number 1 in the world with all of your help. Congrats to everyone. Thank you.
Thank you, Professor Gopinathan. So I will try to lay out the program as it goes. My colleague and partner and friend with me who is going to help me is Professor Vijay Jain. He is a professor of orthopedics, co-moderating today. He works at the RML hospital in Delhi. So we will share our introductions and the videos. I will try to upload the videos in the background, and Professor Jain will introduce the topic. So first, I'm going to start with our first presenter. Is a person who I know from England, Professor Karthik Vishwanathan. He currently is a professor of orthopedic surgery at Parul Institute. So if you give me a minute, I will try to upload his video.
Recording stopped.
Good evening, faculty members and friends. I'm grateful to the Journal of Orthopedics
Recording in progress.
giving me an opportunity to present my talk. The objectives are to simplify this process of literature search and how to select a proper research topic. It may look very complicated, as if looking for a needle in a haystack, but we are going to simplify this. We need it, especially when you're submitting it for a grant application for ICMR or DBT, prestigious ones, when you're going to present your paper in a meeting or publishing it in a scientific good peer-reviewed journal, you need to do a thorough literature search. You will also need it when you're doing a dissertation. It is important to have originality of thought and ideas, hence do a complete thorough search before embarking on any study. Because the last thing you want to do is complete a study only to find that there are already multiple studies prior to yours. Literature search has an important bearing on all the sections of the paper. The most important thing is introduction, wherein you are going to identify gaps in knowledge. And also you're going to formulate a hypothesis. It also will have a bearing on the methods and discussion section of the paper. So literature search is an organized, comprehensive method of searching for published literature on a specific topic. The search may be conducted to find answers and evidence to clinical questions, to identify and develop or refine clinical interventions, or identify a clinical problem or gap. It can be either be done through the traditional method of hand searching, books, journals. It can be an incidental finding based on your literature search, or you would have done a very comprehensive electronic search of databases. A database is a collection of data organized in a manner that facilitates information search retrieval using either a computer or a smart device. PubMed, Scopus, and MPs are commonly used, but PubMed is the most commonly used and open access one. Rest of Scopus and MPs need a subscription. For a very thorough literature search, you need a very good confidant to help you with. The following are the 6 key steps. We'll discuss each one at a time. The first and foremost is to frame the right question. You can either discuss it in the journal club or discuss it with colleagues and try to think about a common topic that you want to select. You can either use books, internet to help you with, but best thing is critical colleagues. This is a common acronym, PICO. Patient, P for patient, I for intervention, C for comparison, and O for outcome. So we want to look at which gives better functional outcome in patients, adult patients with distal lattice fracture. Is it the volar variable angle plate or the volar fixed angle plate? Form this first. Then enlist key concepts, which means they should be searchable on PubMed. You can either use synonyms, acronyms, but you also have to be very clear that the British English and the American English has got certain differences, such as orthopedics. Okay, the spelling of orthopedics in American would be ORTHOPEDICS, while in English, the British one, it would be ORTHOPAEDICS. So these are the key concepts that I think can be used. You should also use appropriate synonyms. So concept 1 deals with the injury, concept 2 deals with the intervention, and concept 3 deals with the outcome measures. You can use the medical subject headings. So on mesh, the section of the PubMed, you can go and search for wrist injuries, select the wrist fracture one. Next, there is also an option for metal plating, but then be aware that this stands for electroplating, not relevant to orthopedics. Choose internal fixation, that will give you both dorsal and volar plates. Patient outcomes, these are the various options. So as soon as you type in mesh, it will give various options which are there. Next, step 3 is to combine the key concepts. So either you can do a phrase searching, which is the most simple method. We can use distal lattice fracture, volar plate, and things, and search. So the first term, distal lattice volar fracture, volar plate, gave about 1504 results. If you go volar locking plate, then it gives 911 hits. Then if you go for variable angle plate, it gives 62. And if you are more specific, that variable angle plate versus fixed angle, it gives only 3. So this first study is a trial protocol, registered trial protocol. Second is a biomechanical non-clinical study. And this one is a narrative review. So there is not many studies, but you can also, in the PubMed, you can also go for similar articles, which will show and list various articles. You can look at the abstract and select ones if there is some suitable ones. So Boolean logic is named after the English mathematician and philosopher George Boole. It is the use of words and or are not in a database search to establish relationship between the words. So distal radius fracture and operative treatment, if these are two groups, how we combine. So if you use the and, it should be in capitals, then all citations on operative treatment in distal radius fracture are selected. If you use or, then all citations on distal radius fracture and all citations on operative treatment are selected. But we have to be careful that this will also include operative treatment of all other injuries as well, which are not distal radius fracture. If you use not, then all citation on distal radius fracture except those who had operative treatment, which means it will select only patients who had non-operative treatment. So if you have to combine all the concepts, then all of them will be combined in this manner. So each individual ones will be connected using or, and between the ones then you use and to search. You can also search for all possible variations of search term by shortening the word and adding an asterisk in a specific truncation symbol, which will expedite the search. This asterisk is known as truncation. Operate asterisk will return results that will contain operate, operative, operating, operational, etc. You can set search limits, like the most recent 5 years articles. You can use it, abstracts. You can also include type of studies such as systematic review, meta-analysis, or randomized trial. And you can also choose elderly patients and exclude pediatric patients. So on the left-hand side, you have an option to choose the type of study. Then you also have an option for additional filter. If you click on it, then you will get an option to be more specific about your choice of either type of article, language, gender, age. So there are some good features in PubMed that if you search, then you can save it and then you can download it as a CSV file. Okay, this is a very good option. But again, here the tip is to choose the maximum. Maximum it is 200. So instead of 10, use it as 200 based on PMID number. So you will get this will get exported as CSV file. If you're using a good software, then you will be able to take out the duplicate numbers. So if you have to increase the sensitivity, which means if you want to do a thorough check, then you use synonyms and extra terms, use broader thesaurus terms, use the Boolean operator or use truncation and remove the filters. If you want to do a quick check, which means to increase the specificity, then you would use less relevant terms, use specific thesaurus term, use the Boolean operator and remove the truncate and use filters. After all that hard work, it is indeed a very satisfying job to do a thorough literature search, and we do learn a lot in hindsight. Thanks very much. I welcome any questions.
Thank you, Karthik. Vijay, next, I'll ready the video behind you.
So the next speaker will be Dr. Vikram Khanna. Dr. Vikram Khanna is an associate editor of Journal of Orthopedics, and he's working in the Sports Injury Center at Dwarka, New Delhi, and has a special interest in sports medicine and deformity correction. So, Karthik, can we start?
Good evening, friends. I'm Dr. Vikram Khanna, and I'll be talking about research questions and research outcomes. A research question is a statement that identifies the phenomena to be studied. For example, does tip apex distance affect the outcome of DHS? A valid and clear research question is well justified, original, feasible, focused, and falls within the area of interest. Coming to the literature review and research question, this is a flowchart, basically identifying the two situations, whether I have a research question or I don't have a research question. Main difference is if I don't have a research question, I'll narrow down to a research topic, look for it in the literature, see whether the research question is viable, original, feasible, and if yes, then we have a research question. Now, if there is no research question, then where to start? Narrow down to an area of research. Within that area of research, try to answer a research question that has either not been addressed before, has been addressed, but you can extend it in a significant way, that is with a new data set or a new different theoretical approach, or pioneer a new research area of orthopedics, which is not recommended. Coming to the literature review, recent publications will contain more updated literature, so try to collect them first. Then read backwards to the most dated study. Make sure that you read all relevant papers, or at least the most influential ones. Ideas on research topic often come from this exercise. That is, if author X has not included factor Y in his study, so then factor Y can be included in your study. If there is a potential question in mind, then reviewing the literature will give us understanding whether the research question has already been answered or is a potentially valid one. Also, by reading previous studies, ideas can be on how to tweak the original research question into a brand new one can be gotten. Again, start by reading the recent publications first. Bottom line, whether or not there is a research question, it is crucial to review the literature first. Leaving the literature review as the last step is very dangerous, as you may find that the question has already been addressed or discarded by the literature because it may not be relevant, not important, not feasible. Now, where to search for papers or relevant literature? My esteemed colleague in the previous study has already discussed the same. Common mistakes when identifying new research question is non-originality, non-feasibility. That is, there may be a time constraint, as these research questions are basically there for a thesis. So there may be a time constraint because the thesis period may be restricted, obviously, and there may be a lack of resources, lack of money, or other data. Then there may be a lack of knowledge on how to do a particular case or particular surgical technique. Then too broadly defined research question or not well justified. So this is an inverted triangle on if you don't have a research question, then how you can go about it. First, think of a broad topic like management of IT fractures, then narrow it down that IT fractures, surgical management of IT fractures, then focus topic, outcomes of surgical management of IT fractures using DHS. And then the research question can be outcomes of whether tip-apex distance significantly affects the outcome of IT fractures using DHS. Now, tips of finding a good research questions are: start searching for the topic as early as possible. After narrowing down the topic, look for relevant literature. The research question should pass the literature review test. That is, has it been done already? No. Why not? And is it interesting or relevant? Ask the following questions. Is the question specific? Is it feasible? Are the resources available? Is the knowledge available? And are there any economic limitations to the study? If the answer is yes to all the previous questions, then we have a research question. Coming to the outcome measures, what is an outcome measure? An outcome measure is a result of the treatment or intervention that is used to objectively define the baseline function of a patient at the beginning of the clinical trial. Once the treatment or intervention has commenced, the same instrument can be used to determine the progress or the efficacy. Outcome measures should be measurable, which indicates that they should be a quantitative value. Now, coming to the primary outcome, defined as the outcome measures of greatest importance specified in the protocol, usually the ones used in the power calculation. Most clinical studies have one primary outcome measure, but a clinical study may have more than one outcome measures. The primary outcome measures are the main reasons why you are conducting the study. Secondary outcome measures, defined as the outcome measure that is of lesser importance than a primary outcome measure, but is a part of a pre-specified analysis plan for evaluating the effects of the intervention or interventions under investigation in a clinical study, and is not specified as an exploratory or other measure. A clinical study may have more than one secondary outcome measure. Other pre-specified outcome measures, they are defined as any other methods, excluding the post-op measures that will be used to evaluate interventions or for observational studies that are a focus of the study. Exploratory endpoints fall into this category. Now, the post-op measures are the ones which have been specified after the trial has started. That is, during the course of study, we find that some interesting development has been taking place. Then we have to include it in the study. Now, coming to the considerations while selecting a study, the number of outcomes. A large number of outcomes may increase the chance of encountering issues. So keep it small, keep it simple, considering the outcomes of that are clinically relevant, achievable, and address realistic research questions. Secondary versus exploratory outcomes. Appropriate secondary endpoints are often used to provide evidence that a particular mechanism underlies a demonstrated clinical effect. However, exploratory outcomes are the ones being used to frame future research and explore new hypotheses. This can be a separate last paragraph in your study, like, what do you expect the future of your outcomes to be. Then outcome measure description. What information is being collected and how is being collected needs to be pre-specified for all primary and secondary outcome measures. If a scale grading method is being used, then it should be pre-specified. Time frame. The specific time points and overall duration of the evaluation must be specified. For example, if we have to assess the functional outcome of a study, then we have to pre-specify that we'll be assessing it on like weekly basis, monthly basis, or 6 monthly basis. We can't keep it an arbitrary value. So it can be, and it has to be pre-specified. If the outcome overall time duration can only be represented quantitatively, a specific numerical value should be included at the time of result reporting. Appropriate quantitative parameter for each outcome. Outcome measures cannot be reported as free text. It is allowed for the outcome measures to be involve qualitative information, but it should be also reported in quantitative measures. Thanks a lot for your patient hearing.
Thank you, Vikram. So I'll prepare the background, Vijay.
So now we have another speaker who will be talking about the components of the research paper, Dr. Sasinder. Dr. Sasinder is a professor of orthopedics at Lakshmi Narayan Institute and has a special interest in arthroscopy and knee surgeries.
In progress.
Good day, everyone. My topic for presentation today is components of a research paper. I am Dr. Sasinder, Professor of Orthopedics from Lakshmi Narayana Medical College, Pondicherry. I serve on the editorial role of these journals. I do not have any other conflicts of interest. Okay, coming to the topic. The often described method of writing an article is the IMRAD format that includes introduction, methods, results, and discussion. However, there are other components that need to be understood that includes title page with author details, abstracts and keywords, conclusion, acknowledgements, and references. The title page should be something like this. It includes the title, the list of authors in the order of appearance, and the affiliation of the authors. The authors have to be given as per the amount of work performed by them. The title should be an eye catcher of the study, should be specific, should be searchable. There should not be any abbreviations in the title, and a running title may be needed as per journal requirements. The title can be descriptive or interrogative with a catchy line. These are some good titles. The Unsolved Fractured Neck of Femur, an unusual case of gluteal pain. The Anatomical Location of Pain in Hip Osteoarthritis, anterior knee pain and osteoarthritis in postoperative cases of reconstruction of the anterior cruciate ligament. These are some good examples of titles of a research paper. In the introduction, briefly introduce the reader to the problem, existing evidence, and the aims of the study. It should be in a funnel-shaped approach. That means mention the problem in a generalized statement and then narrow it down to the hypothesis or the research question. It should stimulate the reader's interest. In the introduction, avoid long introductions, too many references, extensive critique of others' work, and unclear objectives. The methodology should explain and justify the method of data collection and analysis. A methodology is needed to allow others to evaluate what you did, to see if the conclusions are valid, to decide whether the findings are applicable to other situations, and to also allow them to replicate what you did in order to test it and to do further extended research. The methodology should be an overview of the study design. It should include details of equipment, organisms, reagents, etc. used, the population that was studied, whether approval of human or animal research ethics committee was obtained, and the type of statistical methods used. The methodology should be written in past tense. For example, patients were selected, exclusion criteria included, the research study focused. It can include subheads for better understanding, may include figures, for example, flowcharts, diagrams, and tables. Coming on to the results, the result is the core of the paper, often includes tables, figures, should summarize findings rather than actually provide the data. Present results but not comment on them. Allow the readers to take the implication of the results. The results should also be presented in past tense. Example, 55 patients were treated, 38 were males, the time of treatment was, so on. These are some few checklists for the results. Make sure the results are in logical sequence of data presentation, are accurate in data, there's no repetition of data, and there's no overuse and abuse of tables and figures. There are a few points we need to remember with respect to the tables and figures. Use them only if they will help to convey the information. Avoid extensive overlap between the text and the tables. Write appropriate legends for each table and figure. Avoid too much information in one figure. Also, the text should emphasize the findings and not the table or figure. For example, in this statement, researchers who attended the workshop published twice as many papers per year. And in bracket, you mentioned table. Don't say table 3 shows the researchers who attended the workshop published twice as many papers per year. Moving on to the discussion, where the most important and difficult part to write, use short paragraphs. Do not repeat all results of the study. Should not be too long and not more than 50% of the whole article. It should address the hypothesis stated in the introduction, should begin with a brief summary of the main findings, and should move from specific to general, reverse funnel approach. The discussion should compare with other research and see whether the current findings are similar to other publications or better or worse than previous studies, and mention why. The discussion should also talk about the applications and implications of the results. For example, there can be applications in healthcare, public policy, or even in the industry. The discussion should also include an important paragraph with the strengths of the study and the limitations of the study. These are some common mistakes in the results. Too much repetition of data, incorrect interpretation of the results, inadequate interpretation of the results, and failure to identify the weakness of the study. Omission of key references Preferential quoting of references and too long or verbose essays are also not allowed. And finally, we have the summary or conclusions. This is a separate section or the last paragraph of the discussion. Only the most relevant findings of the study should be presented here. It should act as a take-home message and should not be a repetition of the abstract. And finally, you also provide the references, which is the list of sources of information used for the study. The references are needed to avoid plagiarism, show the depth of the research, to acknowledge direct course, to provide evidence to support arguments, and to allow the reader to verify the data. References can be provided in the Harvard style or Vancouver style. In the Harvard style, the references are provided in text in bracket with the first and second author's name and the year of publication. And in the list at the last, it is mentioned in the alphabetic order, whereas in the Vancouver style, the references are numbered in the order of their appearance in the text, and the list is provided in the same order. You can add it up with an optional acknowledgements where you thank people who have helped with the work but did not make contributions deserving authorship. But permission should be obtained from these people, and sometimes you can also disclose your financial support in acknowledgements. All these have to be prefixed by an abstract, which provides an overview of the article. This should be the best paper of the article, and it's also most frequently read part of an article after the title. An abstract should be complete and self-sufficient. No references, tables, or figures should be provided. There should be no or few defined abbreviations. There are two types of abstracts. In the structured abstract, you divide the abstract into subtitles, including background or purpose, methods, results, conclusion, and keywords. In the unstructured abstract, the text is the same but is not divided into subtitles. And then comes the covering letter. Add a covering letter that is very convincing to the editor, and that's it. Your article is ready for submission. Thank you. These are my references. Thank you.
Thank you, Sashi.
So now I invite the next speaker, Dr. Raju Mahajan. He'll be talk on how to write a good abstract. As all of you know that it is an eye catcher, and everyone should read it, and should give the main crux of the paper. So the Dr. Mahajan is an additional professor at B.P. Koryala Institute, Dharan, Nepal.
Greeting from B.P. Koryala Institute of Health Sciences, Dharan, Nepal. Today I am here to describe how to write a good abstract. We know that this is the last part to be written, but the read first. Just like a trailer of a film. So you must hit first and hit hard by using a good abstract. At times, most of the journals, they have a publication of the abstract ahead of the print. And it is to bear in mind that probably this is the only accessible content to a reader, especially for a paid journal. That's why we must have a great impression at the first instance by using good abstract. There is descriptive abstract is just like a summary of an incident or a newspaper or book review like that. But most of the writings is a scientific one. That is a scientific writing is an informative one that is for use for many of the scientific platforms. And I should say that writing abstract is a scientific art to make it sellable for various audience, like from readers, the scientists, the reviewers, the journal editors, and so on. And for various platforms, like from the conferences, from the thesis, dissertations, and abstract of various type of study publications. You must follow some guidelines, like in the form of format, spelling, the grammar, the language, etc. In a language, bear in mind that you have to use either the American language or a British English, but you cannot use both of them. The abstract may be a structure, one in the form of introduction, material methods, result, and conclusion. Conventionally, there is something like IMRAD format, but I don't believe that the discussion is a part of the abstract. It may be an unstructured one, and you may have to follow certain checklist as given by the consort guideline while writing an abstract, especially if you are writing an abstract for a randomized trial. There must be approval from all the authors without no conflict of interest. There must be some word limit or character limit. In online submission platform, there is an auto function for word limit. You must not include any tables, figures, or chart, but at times on some of the platforms, they may allow these at a certain cost of word reduction. You must use the abbreviation that are standard only. There must be no references, videos, plagiarism, no links, and the abstract must be blinded in its body except the title and author affiliation. So that is the first thing to be read. So it must be a catching and interesting one. It's brief but still concise, and it must be a valid one, because most of the times you have taken a sample from one of the hospital or certain part of the country, but the title may says from Nepal, from India, from Eastern Nepal, from Northern India, like that. So these are invalid titles. The titles must be follow a PICOT format like PICOT, that is population, intervention, comparison, outcome, T for time frame, and S for the study type, or maybe in a question format. Making a title concise, crisp, and standard makes it available and searchable, especially during the systematic review and meta-analysis. And there must be all author and co-author have satisfied ICMJ criteria, and there must be proper affiliation. In this case, the patients of tibial fracture, it is the population, treatment is the intervention, solid nail and hollow nail is the comparison, and the functional outcome is the outcome, and it says a randomized trial as a study design. Now, if the co-author of the articles are from multiple departments, you have to specifically mention all of them, either superscript or that one. And if they are from multiple institutes, especially if in a multi-center trial, you must mention all of the affiliation correspondingly. So in the introduction part, you must make an attempt to show it that your study is a feasible, interesting, novel, ethical, and relevant. And you must show the lacunae in the current literature, what has been done and what has not been studied so far. If you are using some newer methods or principles, you have to pre-describe them as well. You must mention what is the rationale of your study. Like in this example, they have said that there is probably the first randomized trial in this study, so this may be a part of a rationale of the study. So aims and objective is not a separate part, but it may be combined with the introduction or a background. You have to show what you want to prove or disprove or achieve in this section. If there are any study hypotheses, you have to mention them. Most of the times, there is a confusion between hypothesis and aims and objective. If you read this, the background carefully, they say that the ability to squat with the mobility of certain joints, and the quality of squatting is a proxy reflection of functional outcome. So this is a hypothesis given by the authors. Based on this hypothesis, the aim was to determine the inter-observer and inter-observer reliability and the sensitivity, specificity of squat and smile test. So this forms the aims and objective of the study. In a material and method section, you have to specifically answer a few broad questions like where the study was done. It's a single university-based IPM center. When the study was done, or study period, in 1 year it says, and then what is the pilot study or type of interim analysis, or what type of study was it, you have to mention. So it says that study and study of prospective collect data. Next is who is the person doing intervention, what is the learning curve, and who are the study subject, whose or whom patient has been studied. So this is basically the inclusion exclusion criteria as given in this article, the abstract. So next is how many patients were recruited, how they are allotted, allocation was done, and how many study samples were there. You have to mention in the method section. And the other important aspect is what was the assessment tool used, whether it is a free available or a copyrighted one, and it is standardized or not. It means with respect to validity, reliability. So he said this is done by independent blind observers, and they have done a repeat observation at 1 month. You should not assess a fish by climbing a tree. Okay? In the methods, you must mention whether the study has been local or national or international approval, what statistical methods has been used, and if there are some outliers, what you have done for those controlling of the outliers. In the results section, you have to give the clinical demographics of your study. Is there any loss to follow-up? How many were lost to follow-up? At what time and what was done to control them? What was the outcome? Was it a specific? What space tool are used? And when the outcome was assessed. In addition to that, all the findings have proper units, there is p-value and the confidence interval. So these are all the findings has been given with their respective p-values. And everybody has a habit of ignoring the complications, but it is not a wise idea. No matter whether it is good or bad, all the important outcomes has to be mentioned in the results section. Like this says there are 2 cases of and 4 cases open reduction, there are some implant failure, there is infection, like that. In the result section, you are not supposed to repeat from any of the portions starting from the introduction and methods like that. But you should not include discussion in your result. However, the result must be in coherence with the aims and objectives and the methods. In the conclusion section, it is probably the second or last part to be read from an article. So you have to make a 1 or 2 crispy, sweet, and strong sentences in a take-home message form. The conclusion must be in line with the title and hypothesis, and it should be supported by the result. You can have some recommendations on the conclusion section as well. Now, last section is the keywords. You have to have 3 to 5 keywords from a medical subject headings that makes your keywords and whole abstract to make it visible and sellable in the market of the wide literature. So these are a few keywords like you have to mention. Okay, thank you for your hearing.
Thank you, Dr. Mahajan.
So the next talk will be by Dr. Madan Jeraman, and he will talk about the making a graphical abstract or infographics. Dr. Jeraman is a assistant professor in Dr. MGR Educational and Research Institute at Chennai, and he has a special interest in stem cell, orthobiologics, regenerative medicine, and orthopedic rheumatology.
Very good evening. I would like to thank Journal of Orthopedics and the editorial team for giving me the opportunity to present on the topic graphical abstract, which is a very important tool for our research. Myself, Dr. Madan Jeraman, I'm working as an assistant professor of orthopedics in Sri Lalikambi Medical College and Hospital. So what does this image indicate? The image on the left side indicates the research and the right side indicates the dissemination, how to disseminate. So here comes an important tool called graphical abstract. It is nothing but this graphical abstract will give you the summary of an article's important findings in a visual manner by using either icons or infographics. So a research has been shown that 8-fold increase in sharing graphical abstract than text-only abstract in the social media. And this graphical abstract has a higher hand among the readers because it takes 6 seconds for the reader to read about 20 words, whereas which is represented in a pictorically, which will take only 1/4 of a second. So this graphical abstract is highly influenced by social platforms such as Facebook, Twitter, and Instagram, and the other one is LinkedIn. So among these, one person acts as a creator of the infographics or the various topics, 9% act as editors, and remaining 90% of the viewers were just consumers of that particular research. So this will help the reader to purview the subject content and to decide whether to read the whole file or not. So what is the triad of the graphical abstract? We have 3 things here. One is it enhances dissemination of the research, what we have done. Second one, it augments the engagement of particular readers or the peer reviewers. And the third one, it's the impact on a clinical practice. So how to create a graphical abstract? There are certain tips to be followed. First, we have to identify the content for creating the abstract. So what all contents to be kept? Because of the space limitation in the abstract, what all the contents have to be kept? Only positive findings to be taken. And the second one is flow of information. The flow should be coherent. Then usage of icons wisely. Diversity and inclusivity. What to be included, what not to be included. And the fifth one is feedback. We have to show it to our peers and to ask the feedback about the graphical abstract. These are one set of tips. The other set is title. The title should exactly match with the findings and what we are intended to tell the scholars. The second one is the font. For example, if you take geriatric population, they may have visual problems. So the font should be in an appropriate manner. It should match with the background of your slide. The space and alignment, because the space is very limited in the graphical abstract. So only positive, important findings which will hitch the readers, that has to be kept. Attribution and copyright. The image which we are going to share should be free from copyrights. And the final checks have been done by 2-3 persons, which are all our colleagues or peers. They will help us to give the feedback on what we added, what we neglected. So these are the 10 tips to be followed for creating an effective graphical abstract. A graphical abstract has 4 areas. That is, the area A is title, area B is methods, the area C is findings, and area 4 is conclusion. So I'll show you an image. This is taken from an ELSEVIER website. The 4 areas. This is the first area. You should consider a visual abstract wallpaper. This area is the area A, where a title has to be kept. Area B is the methods. Area C will be the finding, and area D will be the conclusion. And bottom, the subscript of the abstract should be kept for name, designation, and journal logo. So what are the design principles for a graphical abstract? One is the clarity of purpose. The first one is the clarity. Why this abstract has been created? For what is the use of this abstract? The second one is rapid prototyping. How to rapidly go through the abstract. How fast the reader can read the abstract. Third one is the thoughtful restraint. What thoughts have to be taken back from seeing the abstract? And the final one is relevant creativity. The creativity should be good. It should explain what we are intended to tell the community. So there are certain review articles and papers have been published by Ibrahim et al. These 3 papers tell us how to create a graphical abstract, what are the rules and regulations to be followed while creating a graphical abstract. So how to create? First one, this is a vicious cycle. First one is choosing an article. We have to choose an article, then create visual fields. We have to develop 3-4 fields according to the areas A, B, C, D. So create a visual field and target the visual field with only the particular point with what we are intended to tell. At the subscript, we have to think about the author name, and journal logo, and outcomes. What are the outcomes we have to put for an article has to be kept accordingly, and important findings should be added. The final one is visual icons have to be added, and finally export the graphical abstract in the JPEG form. So what are the debates available on graphical abstract? Who can create graphical abstract? Either the author or the journal's editorial team or the third party. So what specifications have to be there for graphical abstract? And who will review the graphical abstract? And who, how, where it should be disseminated? The first one, first A, who has to be create graphical abstract? It's better the author creates the graphical abstract because author is the sole owner of the manuscript, who will be knowing what positive results has to be disseminated. Second one, specifications should be laid out by the journal, that is author's instruction section, it has to be laid out. And the third one, who will review? Either the author or the reviewer, section editor, or editorial chief of the journal. It is the editorial team who has to review the graphical abstract created by the author. If needed, the corrections can be intimated to the author to correct the graphical abstract because it is the face value for the entire manuscript. And who, how, where it has to be disseminated. It has to be disseminated in 2 ways, either the author or the journal editorial team. They can create a media profile in the social medias where it can be disseminated. A Journal of Orthopedics has published a crossover randomized trial of visual abstract versus plain text tweets for disseminating orthopedic research. They concluded that public engagement on orthopedic research is very low, but since visual abstracts are used to communicate research through social media outlets such as Twitter, the overall engagement on the orthopedic research has increased with visual abstracts than plain text tweets. Social media in surgery, what they tell, this social media has a great impact on science dissemination, journal article discussion, and presentation of conference news. The immediate and real-time presentations of studies, articles can be highlighted in the social media for public engagement. And surgeons and other physicians should learn how to use novel communication technology to disseminate their research and to have a public interaction. Now, one more report on influence of social media on the dissemination of traditional surgical research article. If an article is being done, how to disseminate? Social media plays a major role. Here, once the article is, Bakarma et al., they have studied a survey on how articles are reaching the community. So the article's online activity peaked in first month and plateaued by fourth month. When a blogspot is released, the engagement of readers are more in the blogspot than a plain text abstracts. So social media is very much essential for disseminating the research on a scientific basis. So blog posts resulted in 9% increase in social media influence score and 5% absolute increase in total article page views. So what are the value of social media in disseminating the research? The first one is connecting investigators with a common interest. Second one will be the relevant scientific questions will be asked. Clinical trial networks can be formed, and patient engagement and public awareness can be tried out, and outreach research can be tried. Information on sharing knowledge and dissemination promotes the scientific research among patients, students, and the scientists, like-minded people, and increase the visibility of surgeons, scientific role models, and finally is the feedback and database, creating a database. So what are the pitfalls we come across graphical abstract? These graphical abstract is not a substitute. First one, it is not a substitute, and since the graphical abstract is attracting and appealing to the viewers and the readers, it will be used as a substitute for the manuscript. The second one is oversimplification of the research will lead to a misinterpretation of the results. And the readers, since it is appealing and attractive, it leads to non-reading of the whole manuscript. The next one is the space limitation. Potential pitfall here. Because of space limitation, we may not be able to tell what we are intended to tell through the research. And when we give the graphical abstract to the third party to create, there may be a fallacy, misinterpretation, bias, and inaccuracy in releasing the results. Sometimes the third party may use it as a salami slicing and create a different graphical abstract. Quality check is a main thing which has to be checked among the graphical abstract which is created by the author or editorial team or the third party. And the author may use it for the self-promotion and appraisal, which should be drastically avoided. What are the future directives in creating the graphical abstract? Report the longer period to capture more engagements for graphical abstract to determine the citation in the later stage. This is the first directive we have to think about. The second one is on the engagement of the reviewers or the tweets on graphical abstract by either professional or personal accounts have to be identified, which will pave a long way to identify the potential researchers. And the third one is ideal and the best platform for producing graphical abstract to be identified. As of now, only Twitter is doing very good. And GA creation team has to be created among the editorial board. And graphical abstract repository have to be kept in the journal itself. Infographic training and workshop has to be undertaken by the potential researchers and reviewers for creating GAs, and linking graphical abstract to the manuscript along with tagging and the proper indexing database, that is PubMed Central, Scopus, all these things. Graphical abstract will increase the visibility of the speaker. And finally, we are all intended to use graphic model, that is GRAPHIC. G is get to know the audience. Second one is restrict the use of colors. The third one will be align the elements. Fourth one is prioritize the parts. Fifth one, highlight the heading. Sixth one, invest in imagery. And seventh one, choose charts carefully. Among all these things, all 7 points very important, but the most important point is invest in imagery. So this is one such article which we published recently on mesenchymal stromal cell therapy for rheumatoid arthritis. Below is the graphical abstract. 1 images have been kept, and these images explains what the article is about to deal with. There is one other article which is published in Lancet, totally 4,500 plus authors were there. It talks about the surgical preparedness index and the indicators, how to prepare a surgical system during a pandemic. And I thank everyone for the patient listening, and these are my partnering agents for my research career. Thank you.
Thank you, Madan.
So now I invite Dr. Raja Bhaskar. He will speak on how to write methods and results. Dr. Bhaskar is a consultant in Ganga Hospital, Coimbatore, and his research area is ortho-oncology. Karthik, can you play his video? No?
Respected seniors, colleagues, and my dear friends, at the outset, I would like to thank the Journal of Orthopedics and Raju Vaishya sir for giving me this opportunity. And I will be talking on how to write methodology and results in a research article. These are the most important pillars on how we formulate a research article, and materials and methods and results are vital pillars. And today I will be talking on how we can clearly articulate our thoughts and our process in these materials and methods and the results, so that it helps the editor and the reviewer and also the readers finally in clearly understanding what we intended to study in our research. I would like to share a small experience from my side. In 2019, the American Academy was in Las Vegas and I attended it, and anyone who's attended the Academy, you will understand that there are numerous sessions happening at very different times, all of very high quality. One of the very important sessions was how to publish your paper in high impact journals. And more importantly, of the 5 panelists, 2 of them were Professor Seth Leopold, who is the editor-in-chief of the CORR, and Professor Faris Haddad, who is the editor-in-chief of the BJJ. And the moderator for the session was Professor Mark Swintowski, who is the editor of the JBJS. 3 big giants in the field who were also in this session. So naturally, there was a lot of hype about this, and it was a packed hall. And myself and my next speaker, Dr. Abhishek Vaish, we were fortunate to be there, and we attended this session. And always the most important thing, because I was starting my research career during that time in 2019, and I was just written about 2-3 papers. So I was a novice. But one very important thing which struck me during that time was all the 3 editors pointed out that every day they come across numerous submissions. The first thing how they used to assess whether this is a good paper, an average paper, or a poor paper is they go through the methodology. Methodology. This was the same term how Faris Haddad put it out. You have to give a very clear methodology, and that differentiates an average paper and a good paper from a poor paper. Of course, all the other facets are important. And the other important point that Seth Leopold clearly said was, keep it simple. Don't think too much, don't need to plan too much. Keep it very simple and clear and concise. So with that background, how do we write methodology and results?
Just bear with me. Priyanka, can we mute everyone, please? Because there's a lot of background chatter.
Sure, sir. I've just muted.
So this was one of the collaborative studies which I was involved in, published in the Clinical Orthopedics and Related Research. With this as a reference, we will also see how do we write good methods and results. So whenever we plan methodology, it is important for us to define our study population. Who is the group you intend to study? And for that, using guidelines of STROBE, especially for all the retrospective non-randomized studies and consort for the randomized studies, you can go through these guidelines. Every single step is given there, what you need to do, what you do not need to do, what should you submit, what is essential, and following them, you will be able to deliver a very good, clear methods and results. Also the entire structure of your paper. And whenever you study on a treatment or any intervention, clearly mention the diagnostic criteria used, how many patients were treated, how many were followed up, what was the minimal follow-up, and how many were lost to follow-up. And most importantly, complete your methodology with this: the primary outcomes, secondary outcomes. How did you answer each question? These are vital. And if we look at this specific question which we formulated, what proportion of patients with bone and soft tissue tumors contracted COVID-19 and died? That was the question. So in the methodology, we have to clearly define that it was a retrospective study. What was the time period between March 20 to May 30th? It was the initial phase of the pandemic. Where was the study done? 8 centers of the UK. What was the study number? 347 patients. So this has to come in your first paragraph of methodology. What was the primary outcome? How many patients contracted COVID-19? Secondary outcomes: associated mortality within 30 days and complications. And in our primary outcome and our secondary outcome, the next thing which you have to mention is how was each outcome assessed? What were the modalities? What were the treatments? What were the criteria used? How was the data collected? So in our patient, it was collected from the database of each hospital, and it was a simple observational study. Also, make sure you mention your key sources of bias, and that is important when you in your methods. And now when we come to the results, it's as simple: answer each question. So each outcome which you have mentioned in your methods, answer it, and present the answers. For distributions, use mean or median with a 95% confidence interval and the p-value. Proportions, use the present odds and hazard ratio. For survivorship, always consider using a competing risks estimator much more than a Kaplan-Meier survivorship. Like if we have to articulate our results here, 1%, how many patients contracted COVID-19? 1% of patients contracted COVID-19 and they died in the hospital. The mortality risk among patients who contracted COVID-19 was greater than those who did not have COVID-19. When you say this statement, always back it up with your statistical analysis, as we have shown with our odds ratio and also our p-value with the confidence interval. Specific journals have specific criteria, so keep it very simple. You don't need to write many lines to exactly emphasize on your point. Keeping it very simple gives a better clarity, but back it up with statistics and evidence. And always, the way you express holds a lot of key. Adding a table of how the entire process with all the inclusion criteria, with the exclusion criteria, how many patients were lost to follow-up, how many did not fall into the criteria, how many formed your final group of analysis is very important. So always make sure that methodology is followed by a table, a representative table, and the results, always make sure you draw a specific table where you give even the p-value. And you don't need to express every single aspect of the results in your text. You just need to just show it and also mention and reference your table in your text. And as we had mentioned, these are the top orthopedic journals today, all about 5, nearing 5. And the Lancet, which has an impact factor of 202, driven by pandemic sciences. All of them, as we had seen in that research symposium in the AOS, they look a very big part of their chunk of how they assess is given to methodology. So to summarize, methodology is most important, especially how editors and reviewers assess papers. Clearly define your outcomes, how you assessed your outcomes, and answer each question clearly using variables. Most importantly, keep it simple, but keep it very clear. I thank you for your attention.
Thank you, Raja. Can I ask the faculty to please keep answering the questions in the chat box? I think that will help everyone. Next, Vijay.
Yeah, the next speaker is Dr. Abhishek Vaishya. He will speak on how to review a research paper. Dr. Abhishek is a consultant in Indraprasth Apollo Hospital, New Delhi, and has a special interest in arthroscopy and sports medicine. And I request all of you to please mute yourself because there a lot of noise is coming and it is disturbing the atmosphere. Thank you.
Good evening, everyone. most of you must be a reviewer for one or the other journal, but majority of people don't know what to do when they receive a invitation. So they end up either not doing the review or just stopping to do it. So my topic today is how to review a research paper. So first question is, why should I review it? So it adds to your knowledge. Many journals give you free access to their scientific material. If you are a reviewer, you attain peer recognition for your services. It also improves your own paper writing skills because you get to know more about the topic. And many journals are also providing certificates for reviewing, and they also publish the list of top reviewers in a year. This also benefits the journal in many ways, like being a specialist in your own field, you can identify data fabrication, plagiarism, any image manipulation, or any unethical research which may be happening. An author may be abusing the power to just put up fake author names, or there could be duplicate publications. So these all can be identified by a reviewer, and it is a great help to the journal. So first you will get an invitation, something like this, which will mention the manuscript number, the title of the manuscript, your name, and it will have three options mainly. One would be to accept the review invitation, another would be to decline the review invitation, and another would be to suggest an alternate reviewer if you are busy at that time. So, and there would also be the time duration you would get to review the paper. So all the details are there in the mail. So once you click on the link, you will be directed to a page like this, where if you have the login, you can log in directly. Otherwise, you have to make a new login. So once you have logged in and you can see the paper now, the first task should be to go through the paper as a first assessment. So you should consider the instructions given to the author, the number of authors, whether the paper is in the scope of the article of the journal or not, and if the author has considered and checked the journal guidelines, and the review, whatever suggestions you give to the editor should be unbiased. They should be rigid, but you should not be rude. And there are also some standard checklists available through the journal. They have links like Consort, Stroke, Prisma, which reviewer can use to review the paper. So start reviewing by first making an initial impression of the paper, whether you would accept or reject the paper. Is the main question addressed about the topic of the paper? What is the paper about? Is it relevant? Is it interesting? Is the topic original? Have other authors done similar studies in the past? You should go through this, and the paper should not already be published. Like the topic which is into discussion should not be already published, and it should bring out something new. Is the text well written, easy to read? Are the conclusions given by the authors consistent with the evidence and the questions they had posed initially? If the paper consists of a lot of tables, figures, so are these tables and figures relevant for this study? Or are they easy to read, self-explanatory, or they are just adding to the confusion? You should also check for the language. If it is clear, you could suggest some improvements in the language. You can also suggest if some important points are not communicated properly, you can suggest some alterations so that it is easy for the reader to understand. And you should also mention it to the editor whether you would be interested in re-evaluating the manuscript if it is resubmitted after alterations. Grammatical errors, punctuation should be checked, and there are a lot of softwares which you can use to do that. And you can also suggest to the authors if the English is not very good, if they are not from a country where the English is the main language, they can take help of some language alteration softwares or companies which are available over net. So second assessment is section by section checking of the paper, which includes first the title, whether the title gives us information about the population intervention comparison outcomes, that is PICO. Is the abstract well written? Based on the journal, it could be structured, non-structured. and the keywords are very important. They should include the mesh heading so that it's easy to find this particular paper, and the number of keywords according to a journal that should be specific. Introduction sets out the argument. It should summarize the recent research related to the topic. It should highlight the gaps in the study, and it should also establish the originality, why this paper is published, why it should be published, and why the reader should read this. It should be very clear in the introduction. The material and methods is the most important section of the paper. It should be comprehensive, self-explanatory. If the detail is involved, it should be having an informed consent. Inclusion and exclusion criteria should be very specific and included in this section. The author should have told you how the recruitment happened, how the randomization was done, how the data extraction was done, what were the instruments used, was patient identification disguised or revealed, were there any biased or confounding factors. If there was statistics which was used, so how the power of study was done, how the sample size collection was done, what is the level of significance of the study, if what software and version was used, and if there were any statistical errors, were they mentioned or not. The results tell us what was the outcome of the study. It should be very simple and comprehensible to the readers. There should be minimal repeating. The data should be verifiable online by supplementary files. The consent and copyright should be well given. And if there are any graphical representations like charts, pie charts, diagrams, tables, they should be self-explanatory.
We have lost the voice.
Karthik, are you there?
This study and how it is going to change the clinical practice. What were the shortcomings, weaknesses, and limitations of the study? This should also be mentioned. The conclusion should be exact, short. It should give out a clear message, should not be more than a few lines, and it should be in line with what the hypothesis the authors were talking in the initial time. And we should avoid too many abbreviations. The list of reference should be based on the journal guidelines. If there is an online site which was mentioned, then give the date access should be mentioned. The text references must be cited in text as well. And if there is a confusion, it can be checked by online reference manager software. If you suspect plagiarism, then you can ask the editor to run it through plagiarism checking softwares which are available with the editor, which they usually do. So once this is done, you can put in your systematic comments, avoid harsh words, give the strengths and weaknesses of the paper, and suggest the way in which the paper can be improved, so that the editor can make a prudent decision on this paper. Thank you.
Thank you, Abhishek. Vijay.
Recording stopped.
Vijay, you need to unmute yourself.
So the next speaker will be Dr. Samarth Mittal, and he will be talking on the how to write reviewer comments. And Dr. Mittal is a associate professor at Jayaprakash Darat Trauma Center, New Delhi.
Karthik, any problem in running it?
Karthik, can you hear?
I'm happy that many delegates are asking their question to resolve doubts in their minds. Keep writing in the chat box, and our faculty
Recording in progress.
Sorry for this disruption.
There must be some.
Professor Iyengar is trying to resolve it.
Sir, is the video playing?
Yes, I had checked, it was playing.
Vijay, everything going well?
No, it's not playing here. I can't see.
Okay, I'll start again.
Yeah.
Did we see some of it?
No.
Yes, I did.
Yeah.
Vijay?
Can you start it again, please?
Yeah.
Thank you. There's no video coming.
Yeah, coming. 1 minute.
Okay.
Sorry about that.
I would like to talk to you about how to write reviewer comments, and I extend my special thanks to Dr. Arvind, who has helped me in making this presentation. Now, a well-framed reviewer comment helps in decision-making of the manuscript. It helps the editor or the journal to take a decision on whether to accept the manuscript or to reject the manuscript. When these manuscripts are either poorly organized or too brief, they have very little importance in this decision-making process. Especially inaccurate or inadequate comments, they may sometimes lead to wrong early acceptance of a manuscript, which otherwise had a further scope for improvement, which is then lost. Ultimately, what gets affected is the quality of the publication. Every effort is to be made for putting in a well-organized review in a manner that contributes towards evidence-based medicine. Now, how to organize these comments? First and foremost thing is to read the entire manuscript in its complete entirety. You should read it again for better understanding. And based on that, a recommendation should be reached, like accepting or rejecting based on the journal specific options. And all this should be reflected in the summary that supports the recommendation that the reviewer has written. It should cover the major concerns that are there with the manuscript, the minor concerns, if at all, in the manuscript. But no matter what you do, all these comments, all the review should always be constructive. Now, reading the manuscript. You should first of all only accept the invitation to review a manuscript which falls under your area of expertise. Otherwise, you will not be able to justify reviewing this manuscript. Thoroughly read the manuscript, as this will give you an idea of what the research is all about. And then repeat reading, mark all the issues that are presented in this form of the manuscript, and do a line numbering based comment system when you are doing this, when you are doing repeat reading, as this will help you in later part of the process when you're writing your major and the minor concerns. Now coming to the appropriateness of manuscript, one needs to see whether the manuscript is relevant to the journal or relevant to the literature, and if at all it has this content, whether the same is impactful or not, whether there is clarity on the methodology as well as the manuscript in terms of its results and the details that it gives, whether it gives you any new information, or if there is any novelty in the thought that the manuscript tries to cover up. Look at all the sections like introduction, methodology, results, and discussion, and see whether all of these are centered over the research question or the hypothesis or not. Reporting guidelines such as Prisma, Stroop, whether they are followed or not, depending on the type of the research question. Look at the strength and limitation, whether they are discussed in your review or not. See the relevant references, whether they are cited in this manuscript, because many manuscripts may be written much earlier and they may be sent to you at a later date, and it may miss the recent evidence on that topic. Look at the tables and figures, whether they're clear, relevant, and correct, and whether the data matches to what it is written in the main part of the manuscript. And basic formatting and organization skills of the manuscript should be as per the instructions to the authors for that particular journal. Now, example of a poorly written review is great paper cannot be accepted, can be accepted. Great paper recommend acceptance. This paper does not add anything new to literature, should be rejected. This paper is not appropriate for the journal. There are several flaws in methodology. Now, these are not of much relevance when it comes to a decision-making process, because they are just statements and they are not backed by any reasoning. We need to give a reason why the manuscript is good or it is bad, or if there is any flaw with the manuscript or any concern. That needs to be detailed. While writing the summary of review, you should write it in your own words. What is the summary of the manuscript that it claims to report? By this way, it will show the editor how, as a reviewer, you have interpreted the manuscript, and this will highlight any major difference in the perspective that you see and whether that is different between you and the other reviewers or the editor person. It will give you an overview of the manuscript's strength and weaknesses. Think of this about your own take-home message of the review, and end this section with your recommended action, that is as per the journal's instructions. Now, the major issues. These are essential points that need addressing before any further progress can be made. These are issues which are strict for compliance to the journal guidelines that are stated in instructions for authors, and whether the related, these are issues that are related to the research question proposed in the study. If there is anything wrong there, then this is a major issue. Example, if the rationale of the study has not been adequately described in introduction, and whether the authors have shown how, if they've forgotten to show how the sample size for the study was calculated. Avoid recommending any additional work that can be the next step in the study. Like it is sometimes seen that reviewers say that if this another group was formed in a prospective or a randomized control study, it would have been a much better study. Since these issues cannot be addressed and cannot be formed, hence, as a reviewer, you should avoid making such comments. Coming to the minor issues, they are minor, but they are still very important. These are unrelated issues concerned to the research question. They don't affect the overall conclusion of the manuscript. These may be small grammatical errors, unless they are so big that it becomes difficult to comprehend the manuscript, which then becomes a major issue. It may involve missing inadequate or incorrect references, which can sometimes be a major issue if it is lacking at a major front. Technical clarification like the value of p-value significant or not, whether the significant decimal points are used in a similar manner throughout the manuscript. These are minor issues. And the presentation of results that need to be in a data form when they're crowded rather than in a tabulated form. These are minor issues that can easily be corrected by the authors. Now, confidential comments to the editors. Disclose any potentially competing interest here, because then you are biased in the manuscript. Specify whether you as a reviewer, you're willing to look at the revised version of the manuscript. If you're reviewing for a journal which does not give you option for writing confidential comments to the editor, then write to the journal office directly. And in this section, you can specify any information that questions the validity of the study. If you have any questions about the data manipulation, plagiarism, and if you need any additional information which may not be appropriate for putting in comments directly to the authors of the section. Now, additional points that can be added is recommendation on concrete evidence and specific examples, but one needs to be very specific so that authors can understand how to improve their manuscript. In doing this, one should be very thorough, professional, respectful, but neutral, which is the key here. Remember to include all the good aspects of the study in summary, even if you are not accepting the manuscript for the journal. Don't use the review to promote your own research, because self-citation and promoting your own research through this channel is not the right method. Don't reject the manuscript if it needs significant editing and writing quality. Just mention it in comments so that that can be taken care in the manner editing. So to take home, the review comment should be presented in an organized manner. The recommendation should always be made after thoroughly reading and rereading the manuscript based upon the major and minor issues. Rejection should not be based upon minor issues, especially the editing or grammar. Short reviews should always be avoided as they are not useful or helpful to the editor. And the aim should always be constructive so that the authors can improve the manuscript even if it needs to be rejected. Thank you for your patience.
Thank you, Samarth.
So the next topic will be by Dr. Filippo Miglioroni, and he will be speaking about the biostatistics, what we must know. And Dr. Filippo is a professor in RWTH Aachen, Germany, and has a special interest in orthobiologics, arthroscopy, and cartilage repair.
Pocket Guide for Basic Statistics, Continuous Data and Research by Filippo Migliorini. First of all, we have to point out what are continuous data and systematic reviews. Continuous data refer to data that can be measured. This data has values that are not fixed and have infinite number of possible values. Some example of continuous data would include the height, the weight, or the BMI of the age of a person. Or in the outcome statistic, it includes like the prompts. Prompts are continuous data. Systematic reviews synthesize the evidence on a topic using critical methods to identify, define, and assess research. From a statistical point of view, systematic reviews compare the quantitative results of original research which investigated the same endpoints. For example, systematic reviews will investigate the outcome of a specific treatment for a pathology, or they compare two different treatments or 3 or 4 for the same pathology. The first step for a proper statistical investigation is to analyze data distribution. The Sapir-Whorf test is a test of normality in frequent statistics. So it will investigate whether your data is normally distributed or not normally distributed. In this case, if the Sapir-Whorf test, the P is less than 0.05, data will be normally distributed. On the other side, if it's more than 0.05, data is not normally distributed. From a more strictly technical point of view, the way of expressing the variables change according to the distribution. In parametric statistics, we use mean and standard deviation. In non-parametric statistics, we use median and interquartile range. So first, we check the data distribution using the Sapir-Whorf test. Second, we check how to express values in parametric statistics using mean and standard deviation. In non-parametric statistics, using the median and interquartile range. And now we are clarify how to check the p-value, so to check whether data is statistically significant. But what is this p-value? The p-value in null hypothesis significant testing is the probability of obtaining test results as the results observed, under the assumption that the null hypothesis is correct. So basically it means that if the p-values is significant, it means that if we redo the same analysis under the same assumptions, we will obtain the same results. Reporting p-values of statistical tests is common practice. The trend in the actual literature is to use also the confidence of interval and replacing the p-values, but still the p-value is the most common used tool to evaluate the statistical significance of values. In parametric statistics, we use the student t-test if we are comparing two groups, or the analysis of variance, so the ANOVA test, if we are comparing more than two groups. In this respect, we have to point out that if we want to evaluate the improvement of a group during the follow-up, we use the paired t-test. If we are comparing two different groups, we use the unpaired t-test. When we use the one-tailed or two-tailed test, it depends on the original claim in question. A one-tailed test looks for an increase or decrease in the parameter. So, for example, like PROMs can increase or decrease. In a two-tailed test, we are looking for the change in the parameter. In non-parametric statistics, we use to compare two groups the Mann-Whitney test, or if more than two groups, we use the Cruxwell-Wallis test. Now we are checking the analysis of continuous data in meta-analysis. Meta-analysis compare the quantitative results of head-to-head comparison research. This is different from systematic reviews, which compare the, for example, treatment A at different follow-up to check for their increase, or treatment A versus treatment B versus treatment C for the same pathology. Meta-analysis, they include all head-to-head or whole head-to-head studies, comparison studies, to summarize the evidence. From a statistical point of view, meta-analysis should follow the recommendations of the Cochrane Handbook for Systematic Review of Interventions. Continuous data should be analyzed using the inverse variance method and mean difference effect measure. What is the inverse variance in statistics? In statistics, inverse variance weighting is a method of aggregating two or more random variables to minimize the variance of the weighted average. It means that each variable is weighted in the inverse proportion to its variance. A practical is a weighted average, because some studies, they include lot of participants, big population, big sample size. They have more weight, more impact on the outcome. The mean difference effect measure is the difference of the arithmetic mean of both groups. Heterogeneity in meta-analysis is important to be evaluated. Heterogeneity refers to between study variabilities in outcome. The most commonly used method to evaluate heterogeneity are the chi-square test and the Higgins E-square test. So, if the chi-square is not statistically significant, it means that there is no statistically significant heterogeneity. If the chi-square test is statistically significant, it means that there is statistically significant heterogeneity. To quantify the heterogeneity, we use the Higgins E-square test. As shown in the slide, the Higgins square test, basically from 0 to 50%, the heterogeneity is low to moderate, and from 50 to 100%, the heterogeneity is moderate to high. The heterogeneity refers to data variability, so high heterogeneity, and its data should be highly biased. Funnel plots are used to assess risk of publication bias in meta-analysis. A symmetrical distribution of the referral points in the plots is related with low risk of publication bias, whereas more asymmetrical distribution indicates high data variability, so high risk of publication bias. However, to objectivate data dispersion, there are some tests available. The most used test is the Iyengar test. If Iyengar test is significant, this means that there is a statistically significant asymmetry. So if the P of the Iyengar test is less than 0.05, high data variability is detected, and so high risk of publication bias is detected. If the Iyengar test, if the P of Iyengar test is higher than 0.05, there is no evidence of statistically significant asymmetry. This doesn't mean that referral points are symmetrically distributed, but it means that at least there is no statistically significant asymmetry. So it's important in systematic reviews that the risk of publication bias is objectivated using funnel plot and Iyengar test. Thank you very much for your attention.
Thank you, Filippo. Vijay next. Priyanka, can we mute others, please?
Sure, sir. Just give me a second.
So the next talk will be on how to plan randomized control trial by Dr. Abhijit Salunke. Dr. Abhijit Salunke is an oncosurgeon at Gujarat Cancer Research Institute at Ahmedabad.
Just bear with me.
Yeah.
RCT, randomized control trial, and how to plan a randomized control trial. Greetings from GCRI, Gujarat Cancer Research Institute, Ahmedabad. The learning objectives of today's presentation are to know about RCT and how to perform a proper RCT. We go back into history. In 1747, James Lind was the person who did first clinical trial on scurvy, and he allocated 12 patients of scurvy and treated them with medical management. A well-known reported study is in 1948 on use of streptomycin treatment for pulmonary tuberculosis. So in 2023, can we publish a RCT on this topic? Yes, use of viewing the movie of Bollywood star for patients with bone cancer during their chemotherapy treatment, and what were their self-reported quality of life assessment questionnaires. Can we perform this type of RCT? Yes, it can be performed. Role of viewing sports movies during rehabilitation in patients with ACL tear, and what were their rehabilitation outcomes. What is RCT? Randomized control trial is a study where you divide patients into two groups. First group is proposed new treatment or experimental group. Second is existing standard of care control group, or it can be a placebo group. Medical RCTs are a bit easy as compared to surgical RCTs. In medical RCTs, you can compare two drugs, two vaccines. That is a bit easier method, but in surgical field, it's difficult to plan a randomized control trial. McCullough and his colleagues divided surgical RCTs into three types. In type 1, you compare medical management in surgery. Type 2, you compare surgical treatment methods, two surgical techniques. And type 3 trials, you compare surgical method and non-surgical treatment method. First example, type 1 trials in medical management in surgery, you compare use of tranexamic acid versus placebo in patients with knee replacement and its effect on blood loss. Type 2, where you compare two surgical techniques, robotic knee replacement method versus conventional knee replacement and its effect on functional outcomes. Type 3, where you compare surgical versus non-surgical method, use of knee brace versus knee replacement surgery in osteoarthritis. These are the advantages and disadvantages of randomized control trial. These can be expensive, there can be volunteer bias, and there can be loss to follow-up. According to the publication methods, this is one of the best evidence which is possible in medical fields. So you divide the patients into two groups. One is interventional group, second is control group. Analyze the outcomes at follow-up, and analysis is performed with various statistical methods. First important step is randomization, which is performed with an easy method that is titled as snooze. Means you can divide the patients into two groups. One is odd even number, so that can be a good method, sequentially numbered. Second, when we use of opaque seal envelope, where the investigator doesn't know in which group the patient is divided. Use of computers and mobiles can be done for randomization. How to implement RCT, enroll the participants, assess eligibility, discuss the trial, get a very proper consent, divide the patients into two groups, and how to perform a good RCT, you can use quality control methods. Important method is to report serious adverse events to the investigator. Are there bias in any study? Yes, there can be bias in randomized control trials. How to minimize it? You can divide the patients into three categories. One is single blind, where the patient doesn't know in which group he is. Double blind means the patient and the investigator doesn't know in which group the patient is allotted. Third, triple blind, where the administered person doesn't know where the patient is assigned. How to report the outcomes of a randomized control trial? So consort method is used for reporting these type of studies. How to register a RCT? You can use these two platforms. In India, you have a clinical trial registry, and there is an international clinical trial registry platform. So we go to an example of a RCT where the authors had used viewing Disney movies during chemotherapy on self-reported quality of life in patients with gynecological cancer. The study duration was 1 year. Females were enrolled, given 6 cycles of chemotherapy. They were shown Disney movies before and after the chemotherapy. So 56 patients were used in this study. 28 were in the Disney movie group.
Priyanka, can we mute everyone, please?
And 28 were in the non-movie group. The patient had in both groups similar demographic data and other methods what were used. Patients were analyzed for emotional functioning, social functioning, and global health status was assessed. And this is how the data was published. So take-home messages, how to perform a RCT. You divide the patients into two groups. One is experimental group, second is control group, and the data is analyzed. Thank you very much.
Thank you, Abhijit, Vijay.
So thank you. So the next talk will be on steps to do a systematic review, and the talk will be given by Dr. Anil Bhatt. Dr. Bhatt is a professor and associate dean at KMC Manipal, and he has a special interest on hand and microsurgery.
Hello, everyone. I'll be speaking about how to perform systematic review, which is a very scholarly synthesis of evidence on a very clearly presented topic using critical methods so that you can assess the research on any particular topic. And why do we need this is because there are too many publications coming out every day, almost 8,000 publications per day, and all these are not equally well designed or interpreted. So what we need is a study of studies so that we synthesize the best possible evidence for questions with ambiguity and eventually help practice guidelines, especially in clinical practice. And if you look at the level of evidence itself, the systematic reviews and meta-analysis occupy the topmost place because of The amount of rigorous methodology we use to do these reviews, which are very strictly peer reviewed, and sometimes when we pull in a lot of these studies, it creates a large sample size. And sometimes we can have the best of the studies, the best of the level of studies to do systematic reviews. So even at level 1, we can have 1A and 1B, where only randomized clinical trials are just only them used for systematic reviews, or we use only cohort studies, which is 2A and 2B, or low quality RCTs itself. And if you put up all the clinical trials together, these are called as interventional systematic reviews. If you just add only cross-sectional cohort studies, it becomes more of observational study review. And if you have diagnostic text accuracy studies, these are called diagnostic systematic reviews. Well, what is meta-analysis? A lot of people confuse between systematic review and meta-analysis. Meta-analysis is one step ahead, where we put in quantitative evidence. A lot of data is put up. If you just look at this picture of Mount Everest here, this is just additional of all the data that where is Mount Everest, how is it, and all those things. But if somebody puts in this kind of a data where the height is measured, the amount of meters, the amount of feet, and things like that. So this is what is the difference between just a systematic review and having meta-analysis, where pooling the data to give a one effect size with a larger power, the large sample size, that's what becomes a meta-analysis. So even the systematic review follows the same thought process of any kind of a study, where we first check for research question, what exactly we want to find, what exactly we want to synthesize in terms of evidence. We look at the eligibility criteria and start searching the literature and see whether we do have enough of these. If I want to say, I want to just put in the RCTs of all the RCTs available comparing between volar plating and K-wire fixation distal radius fractures. So I need to see the feasibility of it and see how many RCTs have come out, and then we check for these quality of the studies. So the screening and quality assessment is done, and then we do the final analysis. So it's always a team work. You can't just do it alone. At least 3 people would be required for individually assessing all these studies, the title, screening, abstract, and full text. And any resolution of the differences is required by a third person, who usually is a senior author here. And the data synthesis and the reporting by the entire team is what happens during systematic review. So we already know how to formulate a research question for an article. Same way we do the same thing for the meta-analysis and systematic review also. Along with that, we also ask what is the type of question we are looking at. Is it the diagnostic or a prognostic or a therapeutic kind of an answer I want? And of course, the type of studies which I already mentioned. And based on these, we come out with primary and secondary outcomes. And we also look at the eligibility criteria, as I said. Here, this is an example of closed suctional surgical wound drainage after hip fracture surgery, with drainage and without drainage. And say they included all the randomized control studies which compared this. So that is the first eligibility criteria. Then they looked at the outcome measures here, including wound infection, wound hematoma, and complications. So this is how we come out with the eligibility criteria, and then you start excluding this. So this eligibility criteria is uploaded to your research question also, and also the type of the studies you would be including them. That's how your protocol builds up here. And again, another example here, spinning versus volar locking plate in unstable distal radius fractures here. So again, the search strategy according to the guidelines is given. What type of studies was used, the randomized studies, including non-randomized 2-arm studies, retrospective studies, and of these fractures inclusion also required studies reported data of at least one outcome of interest, that is any of these things, because they were doing meta-analysis for either a grip strength or a pinch strength. So they excluded all these case reports, editorials, and one-arm studies, letters, and all those. So very, very important to have the eligibility criteria. And a very important way to search for these articles would be your keywords. Relevant keywords are very, very important. The same study included distal, external fixation, fractures, K-wires, locking plates, internal fixation, meta-analysis, ORF, and radius. But a lot of times they might not actually throw up all the articles. The best way to do is in a more scientific manner using the medical subject headings through your PubMed, where all these keywords can be tried and see what gives you the best type of keywords. Also, there might be different terminologies, like physiotherapy can be called as physical therapy, spellings can be different, hyphens can be used for some words like non-surgical, and or phrase searching. So putting it in these inverted commas of carpal tunnel syndrome searches it as a single phrase now. There are also some softwares which can mine these keywords, and sometimes you can use connectors like AND or OR, and that can catch up more and more of these studies. So you have huge amount of databases where you can search for all these studies, and you need to mention that in your methodology, what databases you used. And once you've done that, you check the article, identified it, the author 1 and author 2 will review the abstract and also go for full text screening and independently review these two together. And finally, if there's any disagreement, as I said earlier, consensus is by the third reviewer or the senior author, and finally include them in the study. This is the Prisma flow chart, which basically is how you start off documenting how you have done this, all the screening of your articles, how many you got initially, how many you had to exclude, how many duplicate records were there, after abstract, how many you excluded, after full text, how many excluded, and finally, what was the inclusion, number of articles we included, and what was the reasons also why they were excluded can also be put into this. At the same time, parallelly, you're supposed to do this important step of registering your systematic review. And this is the website through the NIHR. This is called the Prospero website, where you need to go in. This is also one of the ways to actually look at what the systematic reviews are being done all over the world. And you can check whether what you thought as an idea of doing systematic is that somebody is already doing it. Or when was it being done? Or, if somebody is registered 2 years before, there's no point in you doing it again. An updated systematic review is at least 5 years should have elapsed for you to do the same thing again, because by then enough data would have accumulated in the world for you to do a new systematic review. So Prospero website is one such thing where you can go in and register, and it tells you what all it accepts, what type of studies it accepts, and it's a good place to start off your systematic reviews. And once you've done that, you need to check the quality of the study which you have included. And this is called as a quality assessment or critical appraisal. And there are a lot of criteria, a lot of tools which are available. Cochrane gives this risk of bias assessment for randomized study. This is the second version, the latest version of that. And you can use this, which gives you, these kind of data charts where you have to enter all the characteristics of each of the randomized studies. It tells you the study characters, how the randomization process was done. All these, if you include, finally you end up with this kind of a scoring system where all the studies you've included shows what is the quality of the study, whether it's low risk or high risk, and then tells people that majority of these studies were good quality studies or majority were not so good. And then you extract the relevant data for your research question based on the protocol, what all you wanted, your primary and secondary outcomes. You synthesize the data. If you want to do meta-analysis, you have to do the statistical analysis for that. And finally, write the discussion, summarize, and interpret the evidence to answer your research question. And then write about the clinical implications for practice or policies. Meta-analysis, as I said, is when you have a lot of data there. So in this particular same study, which I mentioned earlier, they've talked about, scores of DASH, the scores of special analog scale, patient-related risk evaluation scores, range of motion, and complication incidence. So all these have a lot of data points. And so when you have a lot of studies with this, you can pull in the data and say overall range of motion of this in an volar locking plate was this out of all these studies. And that is plotted in this called as a forest plot, where it is an amalgam. It just overall shows all the studies included and what is the trend, what is the association of these studies in terms of the overall interpretation of the included studies. Well, after that, you need to report your systematic review in a structured format. And this is called as a PRISMA, or the preferred reporting items for systematic review and meta-analysis. If you go to this Equator network, you will see these guidelines for all types of studies. Even a case report has a guideline. And if you write your case report as per this, it is easily accepted. So same way systematic review has this PRISMA guidelines, which has about 27 checklist here. So PRISMA checklist, PRISMA flow diagram, which I showed you earlier, PRISMA statement, all these have to be written in your methodology there. So this checklist has 27 questions here. It talks about at each level, how is your title, how the abstract, how is the introduction done, how the methodology needs to be done, how the data should be extracted, how you interpret your results, how to write the discussion. Everything is written. So if you go through this, you know how to exactly do the systematic review. So in summary, a scholarly synthesis of evidence is what we are looking at. And this is a study of all the studies which you choose. And it is at the topmost part of the EBM because it is very rigorous. The methodology is very rigorous. And if you do it in the right way, you will get a very, very kind of good evidence. And as long as we adhere to the guidelines, it gives the best evidence as possible. Thank you so much.
Thank you, Professor Bhatt.
So the last talk is on calculation of the sample size and will be given by Dr. Vivek Tiwari. Dr. Tiwari is a consultant at Apollo Sage Hospital in Bhopal.
Good evening, everyone. I am Dr. Vivek Tiwari. I am a joint replacement and bone tumor surgeon from Apollo Sage Hospital, Bhopal, India. Today I am going to talk about calculation of sample size. Now, sample size calculation is an integral part of the vast majority of quantitative studies. It is important in ensuring validity, accuracy, reliability, as well as scientific and ethical integrity of the study. There are three main parts in its calculation. First is estimation of the sample size, which depends on a host of items. Second is justification in the light of budgetary or biological considerations. And third are adjustments accounting for potential dropouts or effect of covariates. There can be various consequences of getting the sample size wrong, which can be scientific, ethical, or economical. The problems can be approached in two ways. Patient's I-need approach, which is based on calculation of sample size for a given power, significance, and clinically meaningful difference. Or patient's I can get approach, which is based on calculation of power for a given sample size and the level of significance. Now, what are pilot studies? Pilot study is a preliminary study intended to test the feasibility of a larger study, data collection method, and collect information for sample size calculations. It should not be regarded as a study which is too small to produce a definitive answer. Rather, it should be regarded as a tool in finding the answer as long as it is followed through. The sample size calculation may not be required for a pilot study. Now, what is the importance of sample size calculation? There are scientific reasons, ethical reasons, and economic reasons. The scientific reasoning is that in a trial with negative results and a sufficient sample size, the result is concrete. On the other hand, in a trial with negative result and insufficient power, that is insufficient sample size, one may mistakenly conclude that the treatment under study made no difference. The ethical reasoning is that an undersized study can expose the subjects to potentially harmful treatments without the capability to advance knowledge, whereas an oversized study has the potential to expose an unnecessarily large number of subjects to potentially harmful treatments. There are two approaches to sample size calculation. One is precision analysis, another is power analysis. Precision analysis is done in studies concerned with estimating some parameter which need precision, accuracy, and prevalence, whereas power analysis is done in studies concerned with detecting an effect. It is important to ensure that if an effect deemed to be clinically meaningful exists, then there is a high chance of it being detected. There are various factors that influence the sample size calculation. They include the objective, the details of intervention and the control treatment, the outcomes, whether it is categorical or continuous, single or multiple, primary or secondary, what is the clinical relevance of the outcome, any missed data, whether there are any covariates to control, what is the unit of randomization, whether it is individual, family practices, hospital, wards, communities or families, what are the unit of analysis, what is the research design, whether it is a simple RCT, a cluster RCT, an equivalence study, a non-randomized intervention study, an observational study, a prevalence study, a study measuring sensitivity and specificity, a paired comparison, a repeated measure study, and whether are the groups equal. And the factors related to research subjects, what is the target population, what are the inclusion and exclusion criteria, what is the baseline risk, the patient compliance rate, as well as patient dropout rate. The other factors that influence the sample size calculation include, is the follow-up long enough to be of any clinical relevance? What is the desired level of significance? What is the desired power? Whether one or two tail test is employed? Any explanation for the possible ranges of variations in outcome that is expected? What is the smallest difference? And what is the justification of previous data, whether it is published data, previous work, review of records, or an expert opinion? And lastly, what is the software or formula that is being used? We need to know the numerical value summarizing the difference of interest, that is the effect, that is whether it is odds ratio, relative risk, risk difference, difference between means, or correlation coefficient. The p-value, it is probability of obtaining an effect as extreme or more extreme than what is observed by chance. The significance level of a test, that is the cutoff point for the p-value, which is conventionally taken as 5%. The power of a test, that is the ability to correctly reject the null hypothesis when there is indeed a real difference or association. It is typically set at least 80%. And what is the effect size of clinical importance? We need to know whether we need to employ one-sided or two-sided tests of significance. The two-sided tests are used when an alternative hypothesis suggests that a difference exists in either direction. On the other hand, one-sided tests are used when it is completely inconceivable that the result could go in either direction or the only concern is in one direction. Examples are toxicity studies, safety evaluation studies, adverse drug reaction studies, and risk analysis studies. The expectation of the result is not an adequate justification for a one-sided test. So how to approach sample size calculation? First, we need to specify a hypothesis. We need to specify the significance level alpha, specify an effect size, obtain the historical values, specify a power, use the appropriate formula to calculate the sample size. After the study is finished, we need to compare the variance of the actual data with the one used in the sample size calculation. So these are the various formulas used for sample size calculation. For cross-sectional studies, for qualitative variable, for the quantitative variable, for case control studies, for qualitative variable, for the quantitative variable, for cohort studies, and for testing a hypothesis when between two groups when the endpoint is quantitative data and between the two groups when the endpoint is qualitative data. Now, there can be various reasons when failure to achieve the required sample size is there. There can be patient refusal to consent, bad time of the study, that is, for example, heavy clinic study in the winter, adverse media publicity, weak recruiting staff, lack of genuine commitment to the project, lack of staffing in wards or units, or too many projects attempting to recruit the same subjects. So what are the possible solutions? Pilot studies can be done. We can have a plan to regularly monitor recruitment or create recruitment targets, ask for extension in time and of funding, review your staff's commitment to other ongoing trials, and regular visits to trial sites. The strategies for maximizing the power and minimizing the sample size are use common outcomes, use paired design, use continuous variables, and choose the timing of the assessments of primary outcomes to be when the difference is most likely to be optimal. We can have to recalculate the sample size in the mid of the trial when we change the input factors and when there are increasing accrual rates. Retrospective sample size calculation is very controversial and most people recommend to avoid it as it really doesn't add more information in most cases and may confuse or misguide the conclusion. Thank you for your attention.
Thank you, Vivek. So we have come to the talks. I need to thank all the faculty speakers for taking their time, recording the videos, and presenting today. So we are nearly coming to the end of the program, but I have a challenge as a moderator. We have overshot our time. So I have 2 or 3 points. Number one, is everyone happy with the chat box? Is everyone answered or have their queries answered? Then I'm going to request Professor Vaishya and Professor Graichen if they can say a few words, and if I have time, then or can I ask Iyengar if we can overrun for 10-15 minutes and do the paper review, or I can moderate it to 5 minutes. Professor Vaishya, please.
First of all, I would like to thank all the speakers who have taken the time out from their busy schedule to prepare this talk, which were quite informative. I have learned so many things myself, and I'm sure everybody must have done so. Especially the young people who must have absorbed lots of new things and might have ignited the desire to do research and publication, because all of us are basically clinical researchers. It's just we have to sit down, think about it, and present our clinical work as in the research format and publish it. So there were excellent presentation, good participation. In the follow-up, if any of the delegates would like to contact us for any help, we shall be happy to do that. And I would encourage all the delegates to become an official reviewer of Journal of Orthopedics and Journal of Orthopedic Reports because it offers several advantages, as has been mentioned in the talks. Also, would like to invite all the researchers in this group to submit their important research to these two journals, which are the leading most journals of India. Thank you very much. Unfortunately, Professor Graichen has not joined for some reason, I don't know.
Okay, never mind. Next time maybe. But Priyanka, do I have the permission? How long do I have on the call?
I think we have time till 7:30, sir.
Okay.
We still have 20 more minutes to go.
Okay, so 20. So me and Vijay will try to tie it up in 15 minutes. Is that okay?
Yes, sir.
Okay, thank you, Priyanka. So so all of us, all of you, we thought that we would do this paper review, critical review exercise at the end of the program today. It's an article published in JOO and deals with a pertinent problem which we see in India and the middle income company, that is fracture of both bone forearm. Hence, we picked it up as a relevant exercise. The article is already published, so the aim is not to criticize it, but learn from it. Whether can we make it better or is it as good as it is? And I think Vijay had sent 3 questions. So after reviewing this article, whether as a reviewer, as a journal, we would accept it, advise some changes or etc. So my first question, I'll start off. Vijay can take it up from there. And this is a question for Professor Raju and Professor Gopinathan. Professor, what do you think is the research topic that will interest your readership, your journal, and what about the title of the study?
I think since it's a common problem, some
so there's a voice interruption. Can Dr. Gopinathan
it has robust data and good information. The title of this article is like interrogative type, whether this method of treatment, that is nailing of the forearm bones, is useful for the treatment of non-union. Alternatively, the authors could have presented in a more affirmative way that non-union of forearm bones can be treated effectively with nailing. Or they might have used a descriptive way of describing the title. Non-unions by rush nailing, a way by which you can describe the title. The title should be very specific, catchy, and easy to understand, and should focus and emphasize your research.
Thank you. Professor Gopinathan?
Hi, can you hear me?
Yes, your comments, please.
Yeah. Dr. Raju Vaishya, I think, as I commented it perfectly, I have nothing more to add. And that article is already published. So our aim is not to criticize, but to know how to improve. So what Dr. Raju Vaishya said is perfect. Nothing more to add.
Okay, thank you, Vijay.
So I have a question with Dr. Vikram Khanna about whether the authors has formulated the appropriate research question in this article. Can you please briefly tell us?
Yes, I feel that the research question has been very well formulated by the author, and they have also created a good null hypothesis for the paper. So I'm happy with that, and also the primary and the secondary outcome measures have been well defined in the methodology.
Okay. Dr. Bhatt, can you add something on this?
However, probably the entire premise that ORIF was only, they make a statement that's 90 to 100% efficient and also the safety part of it. So there is not a very convincing kind of argument there that why non-union can keep just the stability provided by the names, especially when they again got back to putting in the board graph. So in that there is some amount of kind of doubt there how strong the situation itself is. Because they don't give a very convincing answer as to why this is better. And if you look at the study design itself, they say it's a integral kind of evidence they're trying to synthesize. So in that sense, probably I would not completely agree on that. And it's a retrospective study, so and there's no control group there. So in that sense, the study was a little short on that part.
Okay. Karthik?
Yeah, so before we go to the next, Karthik, you had your hand raised.
Yeah, yes, hi. I just wanted to, put my views. Like, see, if it's a retrospective study, formation of a null hypothesis is not really valid because your data results are already there, isn't it? So null hypothesis should be more for a prospective study, not for a retrospective one.
Okay, anything that can be made better?
Yes, I mean, in the statistics, so I'll come to the statistics bit. It says about a non-inferiority study, but this is a retrospective case series. So
okay,
a non-inferiority
I'll come to that in a minute. Before that, okay. Probably we can ask Rajiv Mahajan and Jain because they wrote on, they talked to us on abstract. What do you think, Dr. Mahajan? And then Jayaraman, please, briefly on the abstract. Are you happy with the layout of the abstract?
Yeah, with the layout, I'm quite happy with this because they have given a structured abstract with all the subheadings like the introduction, the methods, the result, and the conclusion. The feedback, it would have been much better if they have given a few demographic profile of the patient. Like they said, there are 49 patients, but we don't know what was the cause of non-union for this patient, how many were male, female, what is the age group. But there are so many other factors that determines the outcome of a treatment, or there are other factors of non-union like the age, comorbidities. There are so many. What is the duration of non-union? That we have given a little bit more informative to the readers so that they can have an impression of the paper. Otherwise, it's almost fine.
Jairam, could you make it a graphical abstract on this? I think he's not on the call. Vijay, next, please.
So, I have a question with Dr. Abhishek Vaishya. Do you think the introduction was written appropriately, the background was sufficient, and the authors had discussed the gap knowledge?
Yeah, so I think in the introduction part, they mentioned about the prevalence of the study, about the non-union, but they have already said that plating is a proven method to treat non-union along with bone grafting. But they are not very clear about why they want to publish a paper on nailing, and they have not been clear whether they are putting bone grafting, whether they are opening or just doing it closed. So they are not mentioning what is the exact aim of the study, why they are doing a study despite plating and bone grafting being a gold standard for non-union. So the gap in the knowledge part is missing, and the primary and secondary aim somehow I feel could have been better in the study.
Karthik?
Yes. Next, Raja Bhaskar. I think Karthik Vishwanathan has mentioned a bit, but what do you think? Is the study design appropriate? Do you think the ethics, consent, data collection methods have been okay?
Yes, sir. Actually, going through the methodology part of it, the methodology part is actually satisfactory. All the exact parameter, it being a retrospective study, there are the inherent biases and the limitations. But I think satisfactorily, they have mentioned every part. The only thing, as Dr. Mahajan was saying, more details on demographics could have been written, like how many patients had, whether they had an open injury, whether they had diabetes, infection. Those parts could have been written. But overall, I think the methodology is satisfactory, sir.
Okay, thank you. Vijay, I think Karthik was going to speak to us on statistics, isn't it, Vijay?
Yes,
Thanks.
yes. I would like to ask from Karthik and Dr. Vivek about the appropriateness of the statistical method used in this study and also the sample size calculation.
So first, sample size calculation has not been done, right? The second thing, they said that it's a non-inferiority study, right? That is not appropriate because this is a retrospective case series, right? So this is not a randomized control trial. The study of a non-inferiority trial or a superiority trial is used only in the context of randomized control trial. So that is one of the flaws. The other thing is they said that they will compare the results with average data reported in the literature, like, using a compression plate. But the results, they have not mentioned what is the average. They have mentioned a table, like this is 100%, this is this percent, but they have not calculated a thing. But that anyway is not valid only because this is a retrospective study. Again, it shows, they say that in the statistical analysis, patients which show treatment failure and, were evaluated according to intention to treat principles. But that again is applicable only for RCTs, not for retrospective case series, right? Next, they mentioned about inter-rater reliability was assessed using Cohen's kappa coefficient. But in the results section, there is no mention what was the reliability, right? Next, they mentioned about primary outcome was analyzed using chi-square test to compare our results with the data reported in literature. But there is no mention neither in the results nor in the discussion about what it is. What was the chi-square test? If at all they were to do a pooled analysis of all the published literature. But again, that is historical control. So, you're not going to get much out of all these things. And then they say for all the tests, significance was set at p less than 0.05. But if you go through the results, there is no mention whether any of the results they compared was significant, not significant. Neither in the discussion section you find anything mentioned about that at all.
Okay. So, Karthik, can you ask?
Yeah. Professor, you had your hands raised. Do you have a comment?
I think Karthik has rightly pointed out the deficiency in the statistical analysis. This clearly shows, about the ignorance of the authors about statistics, which is a common problem. And neither the reviewers are very up to date. Sometimes editors are all not up to date. And hence, if there is any doubt amongst the authors, reviewers, and even the editors, then the help of statistician is a must.
Thank you.
Yeah.
Thank you. Going to the results. Is Filippo on the call? Or can I ask Samat Mittal, please? Do you think, you gave a talk on methods? What about the results? Have they described the results appropriately, tables, figures? What do you think, Samat?
I think Samat is not there. Can we ask from the Dr. Abhishek to answer about this?
Yeah. I think they have put the results. The results looks okay, but the only thing is that I find very less data on the nailing. It's very unclear when I read it in the first go whether the nailing is open, closed,
and they have just in general put up the complications, and the statistics which is used is very basic, like it's like just putting up the data, which is not giving me much of significant clinical practice changing evidence to come to a conclusion.
So I have again one question, Dr. Vijay. Can you tell whether the authors have described their study in context of published literature? Do you think they have compared or contrasted with the published literature, or they have highlighted their results?
So you're talking about the discussions, right?
Yes.
Yeah. So discussions, I found it was grossly deficient. Because discussion needs to be comparing the already published data on the similar topic and coming out something new with your results. So they have mentioned in the discussion about how they have done the nailing, the method, the technique, and they have also discussed the benefits of nailing, close nailing, which is not pertinent to this non-union case. They are talking about cost, reducing the cost, minimal invasive things, but if we go for a non-union surgery, we want union. Bone grafting is important. They're talking about growth factors, which is absurd because in the whole paper we are not talking about the types of bone grafts or growth factors, but now in discussion they are just coming up, and so I think the discussion has to be really, really good, and it is lacking in this paper.
Vijay sir, can I add on to that, please?
Yeah, are you there, Karthik? Samar?
I absolutely agree with what Abhishek has just said. Even I feel that on the discussion part, there is little that is being discussed. So in a paper like we have already learned, when we are writing a good discussion, we need to compare what has already been described, how there is a lacuna there, and how their study or the results match with the results of the other studies. I think that is lacking here, and it can be improved.
I would further add that, Rajiv Maharaj, somebody said before, the discussion should be described in reverse funnel fashion. So you first focus on the important findings of your research, then compare it with the other published study on similar topic. Don't deviate from your hypothesis or research question. Stick to that. Don't bring in new things. At the last, you can add, if you want to suggest any future direction in that particular field to happen, or you feel that will happen, that will add. And also add limitations and strength of your study.
Yes.
Thank you. Couple of more questions and then we should tie it up. Salom K, I think Abhijit, I have not asked you. Do you think a limitation of study is necessary to all original articles?
Yes, sir, it is very important part of it. Yes, sir. Limitation of study is an important part. So it helps to plan any future study for any next authors. So it's an important part. The author should always include their limitations of the study, and it will be useful for the future readers that they can improve on their own new papers on that same topic.
Thank you. Professor Bhatt, can you summarize overall how does the article look like?
If we go by the discussion what we have heard here itself, I think the article probably falls short of many things. And at the end of the day, we are looking at what guidance it gives to the practices of the surgeons. And we should not go away with the fact that we can't do any in the non-union, especially because it's program non-union, which is so kind of very, very accurate kind of a result we require in terms of propagation stylization. So union, where we have been taught very standard principles of open retraction, internal fixation, wound grafting, sometimes should not be a clue to the young surgeons that can be successful. I think that's what the message should be, instead of looking at the technicalities of the paper itself. I think we will be looking at what message we give to the future generations. Thank you.
Thank you, Professor Bhatt. Professor Vaishya, I am requesting you to conclude now, please.
Yes. I think, as you can see, this was a the blind peer-reviewed article that had gone through the review process, through the reviewers, through the editor-in-chief, still we could find several fallacies in it. And it happens with best of the papers. And one should learn, from this how to improve the quality of your research, because research is the final word. That is, if it gets published, it remains on the world map forever. So if you publish badly, it will remain as a bad example. If you publish good, it will be a good example for others to cite future. Because publication alone has no value until it is cited by the others. It is considered good by the others. So whenever you write a paper or want to publish, think if it will be cited or not. If you think it may not be cited, don't write a paper or don't publish it for the sake of publishing. So I thank everyone for joining this, and I hope that everyone has carried away at least something new from this research. And we hope to see you again next year. And those who want to have similar courses, do contact us. We'll try and encourage our faculty to help you either by their personal visit or through their recorded video, etc. Thank you once again, and good evening to you.
Recording stopped.
Thank you. Thank you so much, all of you. Yes.
Thanks to all of you, sir.
Thank you, Vivek.
Goodbye.
Thank you, sir.
Yeah, it was nice course.
Thank you.
Thank you.
Thank you, sir.
Thank you all. Thank you.
Thank you, sir.